Mr. Davies is a 35-year-old man with a 15-year history of schizophrenia. Despite adequate trials of several atypical antipsychotics, including clozapine, at therapeutic levels, he continues to experience significant and debilitating negative symptoms, such as anhedonia, alogia, and avolition, which severely impact his social and occupational functioning. His positive symptoms are well controlled. Considering the neurobiological underpinnings of treatment resistance in schizophrenia, which neurotransmitter abnormality is most strongly implicated in the persistence of these negative symptoms? A. Mesolimbic dopamine hyperactivity, nigrostriatal dopamine hypofunction, mesocortical dopamine hypofunction, serotonin 5-HT2A receptor blockade, or glutamate NMDA receptor hypofunction. So we're looking here, folks, at dopaminergic pathways. Now, I think the answer could have been, or the list of possible answers could have been a little more nasty if these two had hyperfunction and hypofunction as options. Because when we're thinking about dopaminergic function and pathways, we can rule out nigrostriatal, because that's related to movement. So, for example, if they were having extrapyramidal side effects here, rather than it saying about debilitating negative symptoms, we would choose nigrostriatal hypofunction. So it's either mesolimbic or mesocortical, and you'll remember back to the study materials around these topics. One of these pathways is related to positive symptoms, one is related to negative symptoms. So it's the mesocortical hypofunction that's related to negative symptoms. As a reference, if that had said, if one of the other options had been mesocortical dopamine hyperactivity, this question, or at least list of answers and options, might have been a bit more mean. So mesocortical dopamine hypofunction is related to negative cognitive and affective symptoms of schizophrenia. Okay, so as I mentioned, the mesolimbic dopamine hyperactivity is associated with positive symptoms. So, an aid memoir, if you like, can be that the positive symptoms are related to hyperactivity. Okay, the nigrostriatal pathway, or dopaminergic hypofunction, is associated with EPSEs, such as Parkinsonism, akathisia, and tardive dyskinesia. Serotonin receptor blockade is a mechanism by which many of the atypical antipsychotics exert their action, but not related to negative symptoms per se. And glutamate or NMDA receptor hypofunction is a prominent theory for the pathophysiology of schizophrenia,